Chances are you've never heard the word diastasis, but there's a real possibility you're living with it right now. And here's what most people get wrong. This isn't just something that happens to women after having a baby. Men get it. Kids get it. Even women who've never been pregnant can have it. And if you've been told the only solution is surgery under general anesthesia, stop for a second and listen, because that could turn out to be one of the most costly decisions you ever make about your own body. I'm Dr. Mason Vale, and after 15 years of clinical practice, I've watched too many people get pushed toward operations they never actually needed. So what is diastasis, really? The medical term is Diastasis Recti, and all it means is that your abdominal muscles have pulled apart. Down the center of your stomach, connecting the muscles on your left and right side, is a band of tough connective tissue called the linea alba, the white line. Its job is to hold those muscles together. When that tissue is strong and elastic, everything stays tight. But when it's weak and loose, it stretches under pressure, and a gap opens down the middle. Pregnancy is the most common trigger, since the growing womb stretches that tissue over 9 months. If the tissue was strong to begin with, it usually snaps back after birth. If it was already weak, it stays stretched. And to be clear, a small gap, around ½ an inch above the belly button after childbirth, is completely normal. That's not something you need to fix. Now, 2 big mistakes. First, doing the wrong exercises. If you have diastasis, never do sit-ups, crunches, or anything that lifts your torso or legs off the ground. These moves spike the pressure inside your abdomen and stretch that white line even further, making the gap worse, not better. Second mistake, jumping straight to surgery. When the gap is large, doctors often recommend a procedure to stitch the muscles back together. It works, technically. But surgeons themselves have a saying: the best operation is the one you never needed. In the vast majority of cases, this gap can close naturally, without surgery, through targeted exercise and by correcting nutrient gaps that weaken your connective tissue in the first place. Surgery means general anesthesia, real recovery risk, and permanent scar tissue. Weigh that against a few minutes of exercise a day. Here's the bigger picture. If your connective tissue is weak enough to cause diastasis, that weakness usually isn't limited to your belly. It can show up as varicose veins, hemorrhoids, stretch marks, joint issues, and even certain heart valve problems. So this gap is often your body's early warning sign, not just a cosmetic issue. After childbirth, wearing a supportive band for the first 2 months, then a firming garment for the next few months, helps the muscles gradually draw back together while they heal. Now, the exercise that actually works, and I've tested this myself. Pull your belly button in toward your spine as far as it will go and hold it there. Then pulse it, pulling in short, sharp bursts, deeper each time, without ever letting your stomach relax in between. Keep going until your muscles genuinely start to fatigue, then release slowly. I've seen women scheduled for surgery with a gap of 3 inches shrink that gap dramatically in just 1 month of doing this daily. You can do this lying down, sitting, standing, even while walking, no equipment needed. If your gap is significant, aim for 3 to 4 sessions a day. If it's mild, once a day is enough. Here's your takeaway. Stop the crunches and sit-ups today. Start the draw-in exercise daily. Get your vitamin D and mineral levels checked. And treat this gap as a signal from your whole body, not just your stomach. Do that, and in most cases, you'll never need an operation at all.